You know that feeling, right? That sudden, sharp pain in your stomach that just makes you double over. We've all been there. It's one of the most common and honestly confusing things our bodies can do. So today, we're going to clear it all up.
So let's just get right to the big question. Is that ache you're feeling just some trapped gas that's going to be gone in an hour? Or could it be the first warning sign of something way more serious, like appendicitis? Figuring this out isn't just for peace of mind. It's actually super important for your health. Because, look, when it comes to your health, getting it wrong can have some pretty serious consequences. So let's break down exactly how you can tell the difference between the two. All right, first up, let's talk about the usual suspect, good old gas pain. Understanding what this feels like is really the first step in figuring out if something else might be going on. So here's the number one clue for gas pain. It moves. It's a wanderer. The discomfort might be up high 1 minute and then down low the next. And, big surprise, it usually feels a lot better after you pass some gas or go to the bathroom. And yeah, it's annoying for sure, but it's typically not a pain that's going to completely stop you in your tracks.
Okay, now let's switch gears and look at the warning signs for appendicitis, and you're going to see the difference is pretty stark.
Appendicitis pain tells a very different story. It doesn't just wander around, it actually migrates. It usually starts as this kind of dull ache right around your belly button, but then over a few hours, it makes a journey to the lower right side of your abdomen, and it stays there. And here is the absolute key. Any movement, walking, coughing, even just pressing on that spot makes the pain intensely worse. You might also start to feel nauseous or even run a fever. So let's put it all side by side. This is the quick breakdown. Gas pain moves around and it usually gets better. Appendicitis pain settles in one specific spot, that lower right side, and it just keeps getting worse. Gas pain is manageable. Appendicitis pain can become really severe. If you take away just one thing from this, let it be this slide.
Now, we've got to talk about a factor that introduces some real urgency into this whole situation. Time. With appendicitis, you are literally on the clock, and every single hour matters.
So you see this number on the screen, 6 to 8 hours. What does that mean? Well, this is the critical window. If you're having that very specific, fixed pain we just talked about, this is how long you have before things can get really serious.
And here it is, the bottom line. If that pain in your lower right abdomen sticks around for more than 6 to 8 hours, you cannot ignore it. The rest here is that your appendix could actually rupture, and that is a major medical emergency. Now, the point isn't to scare you. It's just to make sure you know exactly when it's time to act.
So having this knowledge isn't about creating more anxiety. It's actually about the opposite. It's about replacing that worry with awareness, so you know what to do if this ever happens to you or someone you know.
You know, the best way to handle situations like this is just to be informed. So, if you found this helpful, you should follow along for more of these simple health explainers that help put you in control of your own well-being.
So we'll leave you with this final thought. We've talked about one very specific type of pain today, but it's such a powerful reminder to always listen to your body. Now that you know these signs, what's one health signal, big or small, that you're going to make sure you don't ignore from now on?